Welcome to Talking Tinnitus, presented by Lanier. Today we're here with Dr. Gail Brenner. She's the owner of the Tinnitus Treatment Center Philadelphia, has a clinical doctorate degree in audiology from the University of Florida, and amongst many other things, was previously an adjunct professor as well in audiology. So you're very welcome, Gail, to actually the very first Talking Tinnitus with an external Lanier provider that we're recording. So an auspicious honor, perhaps. So today we're going to be talking about pulsatile tinnitus. And I suppose the very first question is, Gail, what is pulsatile tinnitus?
Pulsatile tinnitus is when someone hears a throbbing or a whooshing or a pulsing in their ear or ears. Typically it is one-sided. And it is oftentimes rhythmic with the heartbeat.
Okay. And is there a specific cause or reason why that's the case? And how does it differ from other types of tinnitus?
Yeah, it is actually very different. We call it a somatosound. It's a sound that the body is making. Yep. There are many different causes of pulsatile tinnitus that does have to be medically evaluated.
Okay.
It can be benign. It could be just the pulse for no important reason.
Yep.
And it could be something important. It could be pressure on the brain. It could be blood flow near the ear.
Yep.
It could be a tumor. It could be many different reasons why somebody might have pulsatile tinnitus.
Okay, interesting. And so if you're experiencing that and experiencing it rhythmically, you'd probably recommend that somebody go and get it checked out and speak to a qualified healthcare professional.
I would absolutely.
Relatively quickly to see if it's benign or not benign, as the case may be, and care can follow from that point, I suppose. Yeah.
Correct. I would absolutely recommend that they follow through with their physician.
How common is pulsatile tinnitus within the wider tinnitus scape, if that makes sense?
It is relatively rare to see a patient with pulsatile tinnitus. I mean, there are some patients that come in and say, oh, sometimes I notice a little pulse. I would say that is relatively normal and that it goes away.
Yeah.
But it is for somebody who actually hears it 24/7 that it really has to be evaluated. But it is a rare condition.
Okay. And so I suppose treatment options then obviously may differ from subjective tinnitus, right? And so they might end up going for surgery maybe on something like that, or if they stay within audiology, do treatments potentially differ from, hearing aids? Is there something else that they might do to manage it?
Yeah, surgery is a possibility.
Okay.
But it is rare.
Okay.
For that even to be needed.
Yep.
Again, that really needs evaluation. There are a couple of facilities in the United States that actually specialize in pulsatile tinnitus, and actually one in Toronto that specialize in this condition. But that is more for the extreme
cases. Okay, cool. Okay, so very helpful information. I suppose probably the key takeaway message for pulsatile tinnitus is, if you suspect you have it, if you suspect you have this rhythmic kind of sound that you can hear, go and get it checked out by a healthcare professional.
Absolutely. How to check medically.
Okay, that's great. Thank you, Gail, for that.